Hello and welcome. This is an experimental video. I will be presenting 3 cases to you and some questions have been posed for each case. You are requested to see the video on counseling and menopause and then try to answer the questions which are presented in each case. If you would like me to give you the answers as well, then let me know and then I will make another video with the answers. So let's start. Case number 1 is a 30-year-old married lady with 3 children. All her children were born by cesarean section operation. She suffered severe bleeding at the time of her last delivery and the uterus was removed. The discharge letter states that her ovaries were conserved. Her baby is 3 months old and she is currently breastfeeding her child. Her doctor has told her she will never have any more menstrual cycles. The patient and the husband are very confused, anxious, and afraid. They don't know how this event is going to affect their life, their sexual relationships, and the health of the woman. They want to see if she should be on any active treatment. So as you can see here, a case has been presented to you, and the question is, how is this patient's surgery going to affect her life, her sexual relations, and her health? So you can sit down and answer this question and give yourself some time and time your answer so that you can answer the question in 10 minutes flat. Let's move on to the next question or next case. Case number 2 is Shahnaz. She's a 40-year-old lady with 2 grown-up children. She was diagnosed to have very large uterine fibroids with severe pelvic pain 1 year ago, and she had a hysterectomy, and since then she has not been keeping well. She suffers from severe hot flashes and is experiencing feelings of sadness. She and her husband have not been able to resume sexual relations because of fear of injury or pain. She has come to you and asking you if she needs to be on any medication and what should she expect in the future years of her life. So I hope that you have understood what is the question in this case and that has been posed to you. So again, I will request you to time yourself, and over a 10-minute period, you must answer this question. This is case number 3. Mrs. Sheikh is a 50-year-old lady. She presents with a range of menopausal symptoms that have been affecting her life and well-being. She has been experiencing menopausal symptoms for approximately 12 months. She reports irregularity in menstrual cycles over the past year with progressively lighter flow. She has also been troubled by a variety of bothersome symptoms. She experiences sudden episodes of intense heat, flushing, and sweating, which can occur multiple times through the day and the night. They have been interfering with her sleep and overall comfort. She frequently wakes up drenched in sweat during the night, leading to disrupted sleep patterns and resulting fatigue during the day. She has also noticed mood swings, irritability, and occasional feelings of sadness, which she attributes to hormonal changes associated with menopause. She is experiencing vaginal dryness, which has made intercourse uncomfortable and has led to decreased interest in sexual activity. She struggles to fall asleep and stay asleep, partly due to night sweats and partly due to racing thoughts and anxiety about a changing body. The question is, how will you counsel Mrs. Sheikh and what are her options for dealing with the discomforts of her life change? You have taken her history and some relevant information is as follows. She has noticed a gradual weight gain despite maintaining a healthy diet and exercise routine, which has been frustrating and concerning for her. In her past medical history, Mrs. Sheikh has no significant past medical history and she is not currently taking any prescription medications or supplements. She has never had any surgeries. In the family history, She is a member, which is a house lady with no significant genetic predisposition to hormone-related conditions. Mrs. Sheikh is married and works as a school teacher. She has a supportive family and enjoys an active lifestyle, including regular exercise and a balanced diet. She does not smoke and has no other addictions. So the question is, how will you counsel Mrs. Sheikh and what are her options for dealing with the discomforts of her life change? So if you see my video on counseling, then you will see towards the end of the video, the stages of counseling have been explained. So the stages of counseling are in 6 defined stages or steps. The first one is developing the client-clinician relationship. The second one is gathering information from the patient. The third one is helping the patient to understand the problem. The fourth one is identifying and setting counseling or treatment goals. The fifth one is to help the patient plan to make decisions, thus empowering her. And the sixth one is summarizing the session and planning a follow-up appointment. So what I have done is I have made an acronym DIUGDS. Which is right here. So this acronym can be used to just to remind yourself and to remember. This D stands for developing, the I stands for information, the U stands for understanding, the G stands for goals, the next D stands for decision making, and the last one is summarizing. So if you can just learn what these 6 stages are, and this may help you. The acronym DIUGDS may help you to remember the acronym. Then you even in any situation, if the question is asked, you can then use this to structure the answer. So go to YouTube and search for @Rahat2021. This is my handle, my YouTube handle for the channel called Aqorn Learning. When you reach this channel, then you can look for these 3 videos: clinical counseling, how to approach, evaluation of patient requesting relief for menopausal symptoms, and hormonal therapy for menopause. And this will help you to structure the answer for these 3 cases. With this, we come to the end of the video. Please do subscribe to this channel so that I can continue to make videos for you. Press the like button, send your comments, share with friends and colleagues, and press the bell icon to be notified of future videos. Thank you and goodbye.